The most effective basic technique in preventing and controlling the transmission of infection is hand hygiene. This presentation will cover what are standard precautions, why is hand hygiene important, why are standard precautions important, and what are some other concerns surrounding standard precautions. Standard precautions are a set of infection control practices that healthcare personnel use to reduce transmission of microorganisms in healthcare settings. Standard precautions apply to all patients because every patient has the potential to transmit infection via blood or bodily fluids, and the risk for infection transmission is unknown. What we're saying is with our patients, regardless if we know what sort of communicable disease they may have and things of that sort, there are certain precautions that are standard for everybody. For instance, I will always don my gloves prior to starting an IV. Standard precautions protect both healthcare personnel and patients from contact with infectious agents. Standard precautions include hand hygiene before and after patient contact and after contact with the immediate patient care environment. This includes hand washing with soap and water, as well as the use of alcohol-based hand sanitizers. Personal protective equipment, or PPE, when exposure to blood, body fluids, excretions, secretions, except sweat, mucous membranes, or intact skin is anticipated. PPE includes gloves, mask and eye protection, and gowns. Gloves are used when hand contamination is anticipated. Masks and gowns, or mask and eye protection, are used when splashes may occur, and gowns when soiling of clothes may occur. Standard precautions should be used by healthcare personnel caring for patients regardless of the patient's diagnosis and whether or not the patient is known to have a communicable infection. In other words, standard precautions should be used for all patients all of the time. Hand hygiene is an important part of standard precautions because it can reduce the transmission of healthcare-associated infections to your patients and to you. Infections are a serious problem in healthcare facilities. Every year, an estimated 2 million patients get a hospital-related infection. 90,000 die from their infection. Many infections are transmitted on the hands of healthcare personnel. So when should you be using hand hygiene? A good rule of thumb is to always wash your hands upon entering a patient's room and immediately before leaving the patient's room. Also, immediately before touching a patient, performing an invasive procedure or manipulating an invasive device. Immediately after touching the patient, contaminated items or surfaces or removing gloves. After removing gloves, and after touching items or surfaces in the immediate patient care environment, even if you don't touch the patient while you were there. So even if you're entering your patient's room just to deliver a cup of coffee that you plan on putting on their bedside table without touching anything else in the environment, you would still be required to enter the room, put down the cup of coffee, wash your hands, dry them, deliver the cup of coffee to your patient's bedside table, and then wash your hands before leaving the room. While that may seem a little extreme, you see here it doesn't say anywhere on this list that even if you don't touch anything in the environment, wash your hands. The reason why you need to get into the habit of washing your hands upon entering the room and prior to leaving the room is because sometimes you enter that patient's room just expecting to put a mug of coffee on the bedside table. And while you're there, you end up being there for 20 minutes and helping the patient with this or that, and you don't even realize that you've now interacted with the patient and his or her environment without washing your hands upon entering the room. And the same can happen upon leaving the room. So please make sure to always wash your hands upon entering and prior to leaving the patient's room, in addition to before and after putting on gloves and touching the patients and performing any invasive procedures. So when should I practice hand hygiene? Whenever your hands are visibly dirty or contaminated is a definite yes. And if your hands look visibly dirty, you should be using soap and water to wash them. Also, before having contact with patients, before putting on gloves, before inserting any invasive device or manipulating any invasive device. Also, you'd want to wash your hands after having contact with the patient's skin, having contact with body fluids or excretions, non-intact skin, wounds or dressings, contaminated items. or having contact with inanimate objects near the patient, because anything that the patient may have coughed on the bedside railing or had their Kleenexes on their bedside table that are now gone, but you know the table is not contaminated and you touch it. And then also after removing gloves, you always want to wash your hands. So again, you go into the patient's room and you don't even touch the patient. Why do you have to wash your hands? Or perform hand hygiene, I should say. Bacteria can survive for days on patient care equipment and other surfaces. Surfaces in the patient care environment, including bed rails, IV pumps, and even computer boards, are often contaminated with bacteria. It's important to practice hand hygiene after you leave the room, even if you only touch patient equipment and other surfaces. Alcohol-based hand rubs kill more effectively and more quickly than hand washing with soap and water. They're less damaging to the skin than soap and water, resulting in less dryness and irritation. They require less time than hand washing with soap and water. Bottles and dispensers can be placed at the point of care, so they are more accessible. Hand washing is defined by the CDC as the vigorous, brief rubbing together of all surfaces of lathered hands, followed by rinsing under a stream of water for 15 seconds. The fundamental principle behind hand washing is removing microorganisms mechanically from the hands and rinsing with water. A regular soap probably isn't going to kill any microorganisms, but it can loosen those microorganisms from your hands, and then those microorganisms can be rinsed away. An antimicrobial soap will do a better job at killing bacteria, and the best job would be done by an alcohol-based hand rub that is used correctly. An alcohol-based hand rub is the preferred method for hand hygiene in all situations, except when your hands are visibly dirty or contaminated. To use an alcohol hand rub, you would apply the foam or gel to the palm of one hand. The amount used depends on the specific hand rub product, and then rub hands together covering all surfaces, focusing in particular on the fingertips and fingernails until dry. Use enough rub to require at least 15 seconds to dry. For hand washing, you would want to wash your hands with wet your hands with water, apply soap, rub hands together for at least 15 seconds, covering all surfaces, focusing on fingertips and fingernails, and rinse under running water and dry with a disposable towel. Use a separate towel to turn off the faucet. Be a role model at the facility where you are employed or the facility where you attend clinical. People on the floor are watching you, potential future employers, future coworkers, and it sets a good standard. You, the student, may be the person that gets another worker, maybe an experienced RN, in the habit of good hand hygiene because they watch you and decide to go ahead and wash their hands in the best manner that they can. Also, patients are watching you. So especially as nursing students, you know, you want to go in and try that IV stick on the patient. You want to convey the message that you are a serious nursing student and that you know what you're doing. And one of the most basic things you can do is practice hand hygiene. All right, so you have hand hygiene down. What additional standard precautions should you practice? When appropriate, you should wear gloves, gowns, masks, eye protection, and face shields. You should use gloves when hands may become contaminated with blood, body fluids, excretions, or secretions, or when touching mucous membranes or non-intact skin or contaminated surfaces or objects. You want to use gloves when touching open wounds or mucous membranes, such as the mouth or respiratory tract, when touching items that are likely to be contaminated, such as urinary catheters or endotracheal tubes. You also want to be sure to change gloves between patients and remove gloves after patient care. Of course, you'll want to wash your hands when you take those gloves off. Be sure to put on new gloves before contact with non-intact skin or mucous membranes. Wear gloves during contact with bodily fluids or contaminated items. Remove gloves after caring for a patient. You don't want to wear the same gloves for more than one patient, and do not reuse or wash gloves. Don't forget hand hygiene after removing the gloves. Wear a mask and eye protection or a face shield during procedures that are likely to generate splashes or sprays of blood, bodily fluids, secretions, and excretions. Wear a gown during procedures that are likely to generate splashes or sprays of blood, bodily fluids, secretions, or excretions. Secure the gown appropriately. Remove a soiled gown as soon as possible and practice hand hygiene after removing the gown. You want to keep your natural fingernails short and not wear artificial nails when having direct contact with high-risk patients. Congratulations, you're well on your way to preventing healthcare associated infections.